by continuing past the last sound while the mercury column drops at the usual rate of 2 millimeters per second. If the last sound is heard very early, listen for an additional 40 millimeters. Otherwise, listen for 10 to 20 millimeters beyond the last sound heard. Then, immediately release all pressure and record the reading. Remember that extraneous sound and artifacts also occur normally when taking blood pressure readings. Learn to distinguish these sounds as separate from the corruptible sounds and disregard them. Eliminate the sources of artifacts when possible by using good techniques and choosing favorable surroundings when taking blood pressure measurement. Now, in a few seconds, you'll hear 2 practice examples using the mercury sphygmomanometer, then the aneroid manometer.
You should
notice that the mercury column and the manometer will fall at the correct rate of 2 to 3 millimeters per second. This exercise allows you to test your ability to hear and evaluate blood pressure sounds without having to handle the measurement equipment. Practice the concentration and memory needed when taking an actual blood pressure by waiting until you hear both the systolic and diastolic before recording the blood pressure. You may hear extraneous sound, which occur normally when taking blood pressure. Now listen and record your measurement.
over the 8. 60 to.
The blood pressure in the first example was 120 over 104 over 86. 120 is corrupt of 1, 104 is corrupt of 4, 86 is corrupt of 5. The blood pressure in the second example was 132 over 110 over 98. 132 is corrupt of 1, 110 is corrupt of 4, and 98 is corrupt of 5. If you miss the systolic or diastolic in either of these two examples by more than 4 millimeters, you need more practice using the additional example tapes. If after the practice you continue to make errors,
go kill yourself.
or if your readings are usually too high or too low, you may have a hearing loss.
Harsh, oi! You may have hearing loss.
Wala kikikuan ba nagbuba ang swing mo?
Lagi?
Complete or feel from the pulse between the biceps and triceps muscles.
Jadi ay.
Press firmly and move your fingers to trap the artery against the arm bone.
Diha, dili dire.
This pulse marks the artery used to determine the position of the cuff and the bladder.
Anak mana dira.
Now you're ready to use the sphygmomanometer. The first step is to select the correct cuff size. Do this using one of the three methods described in Module 2. Make sure each
50%
client
length.
knows the correct cuff size needed for their own arm. Locate the bladder center by folding it in half. The center mark on this cuff correctly identifies the center of its bladder. Next, center the bladder directly over the brachial artery. Centering ensures that when the bladder is inflated, the pressure of the artery is distributed evenly and will fully occlude the blood flow during blood pressure measurement. Holding the bladder center directly over the artery, wrap the cuff smoothly and snugly around the arm. Be careful not to move the bladder in relation to the artery. When in place, the lower edge of the cuff should be 1 inch or 2.5 centimeters above the bend of the elbow. Leave room for the stethoscope head to rest over the artery without touching the cuff or tubing. A properly snug cuff allows no more than 2 fingers between it and the arm. Next, determine how high to inflate the cuff. The pressure exerted on the artery must be high enough for an accurate reading. Going higher than this may cause unnecessary discomfort or pain. You determine the maximum inflation level by feeling for the radial pulse located at the base of the thumb. This pulse is also used to determine heart rate and whether the pulse is strong and regular. Find the maximum inflation level by palpating the radial pulse to estimate the systolic and adding 30 to that number. Here's how to palpate the systolic level. Locate the radial pulse in the arm wearing the cuff. While feeling for the pulse, quickly inflate the bladder of the cuff to about 60 millimeters of mercury. Then, with a slowing inflation rate, pulsing very quickly at 10 millimeter intervals, continue feeling for the pulse. Remember the number at which it disappears. The point in which you stop feeling the pulse is the palpated or estimated systolic reading. It indicates the point at which the amount of pressure exerted by the inflated cuff through the tissues and against the artery becomes greater than the blood pressure inside the artery. When cuff pressure is greater than the arterial pressure, the artery is pinched or occluded, stopping blood flow. You no longer feel the pulse. If you're unsure of the estimated reading, you can double-check by continuing to palpate as you deflate slowly. The pulse will reappear when the pressure inside the artery becomes greater than the pressure exerted by the bladder. This point should be nearly the same as the point of disappearance. Immediately deflate the cuff as soon as you palpate the estimated systolic. Wait 15 to 30 seconds before re-inflating the cuff. Failure to wait between readings and allowing pressure to stay on the arm or deflating too slowly causes forearm congestion and makes sound difficult to hear. Add 30 millimeters to the palpated systolic to get the maximum inflation inflation level, or MIL. One can also determine the maximum inflation level by feeling the brachial artery. The next step is to position your stethoscope over the brachial artery where you can best hear the cough sound. Palpate for the brachial pulse where the artery splits or branches just above the bend of the elbow at the inner aspect of the arm. Find the point where the pulse is strongest. Lightly place the bell of the stethoscope over that point, making sure that all edges are in contact with the skin surface. Inflate the cuff to the maximum inflation level and deflate at a steady rate of 2 millimeters per second while listening to cough phases. Listen to and record phases 1, 4, and 5. You're almost ready to assess your ability to recognize actual blood pressure sounds. But first, let's take a brief look back at the 3 key phases of blood pressure readings. First, you must learn to identify cough 1. The first of at least 2 regular tapping sounds. It is the accepted systolic in adults and children. Second, cough 4, the onset of muffling, is the accepted diastolic for children up to age 13 and is recorded whenever sound is heard to 0 in all age groups. Always record cough 4 with cough 5, the point at which the last sound is heard. Third, cough 5, the onset of silence, marked by the last sound heard, is the accepted diastolic reading in anyone over age 13. All right. In summary, during this module, you've learned how to recognize cough sounds and use them to measure blood pressure, how to center the blood pressure cuff over the brachial artery, how to determine the maximum inflation level and avoid the errors that occur when you misread the auscultatory graph, and where to listen over the brachial artery to best hear the cough sounds. Now, test your skills by reviewing cough sounds, locating the brachial and radial arteries, and measuring the maximum inflation levels. Remember, if you know what to listen for, yet continue to make errors, you may have a hearing problem.
Sorry, sanggup ka wala hearing problem.
Pwede may problem sa equipment. Hearing problem din.
Hearing problem na diretso.
Late ka na na-realize paano mag-focus.
Paano?
Hindi ka mag-press. Mag-learn siya. Hindi ka mag-press.
Hello. Next time.
You will proceed to the other room for ECG lecture, after which you can borrow blood pressure for you to practice regularly. Okay? So there are 10 DP apparatus, 5